G'day, everyone. Dr. Zoe Mitchell here. Now, I know what you're thinking. What's a Sheila doing talking about blokes' health? Well, I've been a urologist here in Melbourne for over 20 years, and let me tell you, I've heard it all. Nothing shocks me anymore, and today we're going to have a proper chinwag about something that affects 7 out of 10 men over 50, and barely anyone wants to talk about it. Right, so here's the thing. Just last week, I had a patient in my clinic. Lovely bloke, 62 years old, sits down and says, "Doc, I'm worried. I've been noticing some issues down there, and I'm wondering if, having a bit of me time is making things worse." And you know what? He's not alone. I reckon I hear this question at least 3 or 4 times a week. So today, we're going to talk about your prostate health and masturbation after 50. Yeah, I said it. No beating around the bush here, folks. Before we dive in, do me a favor and hit that subscribe button. I promise you, the information we're about to cover could genuinely change your quality of life, and I want to make sure you don't miss out on future videos where we tackle all the health issues that really matter to you blokes. Now, let's start with the basics because I reckon a lot of you don't actually know what your prostate does. Your prostate is about the size of a walnut, bit bigger for some of you older gents, and it sits right below your bladder, just in front of your back passage. It's part of your reproductive system, and its main job is producing some of the fluid that makes up your semen. Pretty important little organ, right? Here's the kicker though. As you get older, your prostate naturally gets bigger. It's called benign prostatic hyperplasia, or BPH for short. Basically, it means your prostate is growing, but it's not cancer, just an annoying part of getting older, like grey hair or your kids telling you your music's ancient. This growth can cause problems with urination. You might find yourself getting up 3 times a night for a slash, or the stream's not what it used to be. Sound familiar? Yeah, I thought so. So this brings us to the big question. Does masturbation help or hurt your prostate health? And before I answer that, I want to be crystal clear about something. Masturbation is completely normal and healthy. It's a natural physical and psychological activity, especially for adults. I know we Aussies can be a bit awkward talking about this stuff. We'll happily discuss the cricket scores for hours, but mention wanking, and suddenly everyone's looking at their shoes. But here's the truth. It's normal, it's healthy, and it's time we stopped being embarrassed about it. Masturbation has heaps of benefits. It's not just about physical pleasure, though that's certainly part of it. It helps you stay connected with your body, reduces stress significantly. And here's the science bit. When you climax, your body releases endorphins. These are your natural feel-good chemicals that reduce anxiety, improve your mood, and promote general well-being. For many older blokes, especially those who've lost a partner or are going through a rough patch, this practice can help combat loneliness and even depression by providing a moment of personal connection with yourself. No partner required. But let's get to the real meat and potatoes of today's discussion. What does the science actually say about masturbation and prostate health? Because I'm not here to just give you feel-good nonsense. I'm here to give you facts backed by proper research. A groundbreaking study from a major university, and I'm talking about rigorous, peer-reviewed research here, found that men over 50 who ejaculate regularly have a significantly lower risk of developing major prostate problems. And when I say regularly, I'm talking about 2 to 3 times per week. Now, that doesn't have to be through masturbation. It can be with a partner. But the key finding is that regular ejaculation is protective for your prostate health. Why? Well, let me explain the mechanism. When you ejaculate regularly, you're helping to clear out secretions that build up in your prostate. If these fluids aren't expelled, they can increase your risk of infection and inflammation. Think of it like this. If you had a pipe that wasn't flushed regularly, gunk would build up, right? Same principle. Regular ejaculation keeps things flowing smoothly, reduces pressure in the prostate area, and decreases the risk of urinary problems that come with an enlarged prostate. Another urological study showed that men who ejaculate 2 to 3 times a week have fewer urination problems related to enlarged prostate. The ejaculation reduces pressure in the prostate region and clears out stored chemicals, which means less risk of those annoying nighttime bathroom trips I mentioned earlier. Now I want to address something that came up in the comments on similar videos, and it's about testosterone. One of you blokes asked, "What about testosterone levels? What about libido?" Bloody good question, mate. Here's the thing, testosterone levels naturally decline as you age. By the time you're 60, you might have about half the testosterone you had at 20. This affects your sex drive, your energy levels, your muscle mass, and yes, your ability to get an erection. But here's what's interesting. Regular sexual activity, including masturbation, can actually help maintain healthier testosterone levels. It's not a miracle cure, but it's part of the puzzle. If you're concerned about your testosterone, and you should be, if you're noticing major changes in your libido, energy, or mood, go see your GP and get your levels checked. Simple blood test, and if they're low, there are treatments available. Let me also talk about something that doesn't get discussed enough, the role of blood flow. Maintaining healthy blood circulation in your genital area is crucial. Regular activity, including masturbation, helps keep tissue well oxygenated and contributes to the health of your reproductive system. It can help prevent erectile dysfunction by keeping the tissue healthy and sensitive. Think of it like exercise for any other part of your body. If you don't use it, you lose it. Now, I saw another comment that really struck a chord with me. One bloke, 60 years old, said he hasn't been able to get an erection in years and can't ejaculate anymore. He said, "That's just what happens when you get older." And you know what? I respectfully disagree. While yes, things change as we age, complete erectile dysfunction at 60 is not inevitable. If that's you, please go see a doctor. There might be underlying issues, cardiovascular problems, diabetes, low testosterone, or side effects from medications. These are treatable conditions, folks. Another commenter, 70 years old, said he and his wife still have good sex twice a week. He told the other bloke to change his doctor and get proper advice. And you know what? He's absolutely right. Your doctor should be helping you maintain quality of life, not just shrugging and saying, "You're getting old, deal with it." Right, so let's talk about what actually impacts your prostate health beyond just ejaculation frequency. One of the comments nailed it. There are 5 major risk factors, what he called the 5 horsemen of the apocalypse. Obesity, lack of exercise, poor diet, alcohol abuse, and smoking. These are huge, folks. If you want to protect your prostate, you need to address these lifestyle factors. Maintaining a healthy weight is crucial. Studies show that obesity significantly increases your risk of prostate problems, including cancer. Regular exercise, and I'm talking about a good walk every day, maybe some swimming, a bit of time in the gym. This improves circulation, helps with weight management, and reduces inflammation throughout your body, including your prostate. Diet matters too. You want to be eating plenty of vegetables, especially tomatoes, which are rich in lycopene, brilliant for prostate health. Fatty fish like salmon for omega bars, nuts, and seeds, and cut back on red meat and processed foods. I know, you blokes love your snags and steaks at the barbie. I'm not saying never have them, just don't make them your daily staple. Alcohol and smoking? Look, I'm not going to lecture you like you're a kid. You're grown men. You know smoking's bad for you. But here's what you might not know. Smoking specifically increases your risk of aggressive prostate cancer. And heavy drinking can worsen urinary symptoms and increase inflammation. Have your beer at the footy, enjoy a wine with dinner, but keep it reasonable. Now, here's the part where I need to pump the brakes a bit. Masturbation is not a cure-all or a standalone treatment for prostate problems. It needs to be part of a complete approach to health that includes good nutrition, weight management, and pelvic floor exercises. Yes, pelvic floor exercises. These aren't just for women, blokes. Strengthening your pelvic floor muscles can improve bladder control and sexual function. Look up Kegel exercises for men. They're dead easy to do and can make a real difference. I also need to mention some important warnings. If you have active prostatitis, that's inflammation of the prostate, or you're in the acute phase of a prostate infection, masturbation might not be appropriate. Under these circumstances, the prostate and surrounding tissue can be very sensitive, making the activity uncomfortable or even painful. Always consult with your doctor about what's appropriate for your specific situation. If you have prostate cancer, especially if it's advanced or you're currently undergoing treatment, you need to have a conversation with your oncologist about sexual activity. In some cases, it's perfectly fine. In others, there might be reasons to modify your activity. Don't make assumptions. Get professional advice tailored to your situation. I also want to address the psychological side of this. Many blokes worry that masturbation is somehow shameful or that it'll make their health problems worse. This kind of thinking can create anxiety and guilt that actually harms your mental health. I've been doing this job for over 20 years, and I can tell you, doctors recommend you change your attitude. View this practice as a form of self-care rather than associating it with negative feelings. Take a balanced perspective and recognize that intimacy is an essential part of human well-being. Coming to see a doctor about these issues doesn't just clear up doubts. It provides relief. It eases anxiety and offers personalized support for maintaining an active, intimate life safely and conscientiously. I know it can be awkward sitting across from your GP talking about your sex life, but honestly, we've heard it all. Your doctor would much rather you came in and asked questions than sat at home worrying in silence. Let me share a bit of practical advice now. If you're over 50 and want to maintain good prostate health, here's what I recommend. First, aim for ejaculation 2 to 3 times per week, whether through masturbation or partnered sex. This frequency seems to provide the protective benefits we've discussed. Second, get regular checkups. From age 50, you should be having prostate checks regularly. If you have a family history of prostate cancer, start even earlier. These checks can catch problems early when they're most treatable. Third, pay attention to your urinary symptoms. Are you getting up multiple times at night? Is your stream weak? Do you feel like you can't fully empty your bladder? These could be signs of BPH or other issues that need addressing. Fourth, maintain a healthy lifestyle. I've already banged on about this, but it bears repeating. Healthy weight, regular exercise, good diet, limited alcohol, no smoking. These aren't just good for your prostate. They're good for your heart, your brain, your entire body. Fifth, stay sexually active in whatever way works for you. Whether that's with a partner or by yourself, maintaining sexual function as you age is important for your physical and mental health. And blokes, if you have a partner, communicate with them. One comment mentioned that wives should encourage their husbands more. Intimacy in a relationship is a two-way street, and honest communication about needs and desires is crucial. Now, let's talk about something that often gets overlooked: the connection between your prostate health and your overall quality of life. Intimacy isn't just a biological act. It's an essential component of general well-being that has strong connections to mental and emotional health. As we get older, our bodies and our intimate processes change. But that doesn't mean you should give up on a fulfilling, intimate life. Far from it. Understanding these changes and rediscovering your own desires and intimate identity is important. Consciously engaging with these aspects contributes deeply to well-being, promotes a healthy, intimate life, and improves quality of life at any age. A balanced approach to intimacy in adulthood is closely connected with healthy lifestyle habits that not only promote physical health and mental clarity, but also enable greater joy in life and stronger bonds with others. I reckon one of the biggest challenges for older blokes is the mental side of these changes. When you're younger, things just work, right? You don't think about it, but as you get older and things don't work the way they used to, it can really knock your confidence. Some blokes start avoiding intimacy altogether because they're worried about performance. But here's the thing: intimacy isn't just about performance. It's about connection, pleasure, and maintaining that important part of your identity. If you're struggling with erectile dysfunction, premature ejaculation, or loss of libido, there are treatments available. From medications like Viagra or Cialis to testosterone replacement therapy to counseling, there are options. Don't suffer in silence thinking, well, I'm old now, that's just how it is. Bollocks to that. You deserve to enjoy your life, and that includes your intimate life. I also want to touch on something for those of you who might be single or widowed. Masturbation can be particularly important for you in maintaining sexual health. It keeps the tissue healthy, maintains function, and provides the mental and physical benefits we've discussed. There's absolutely no shame in this. It's self-care, plain and simple. For those of you with partners, remember that intimacy can take many forms as you age. Exploring other forms of physical intimacy and pleasure can actually enrich your relationship and take the pressure off performance. Communication with your partner is key. Talk about what feels good, what doesn't, what you're worried about. You'd be surprised how much stronger your relationship can become when you're honest about these things. Now, before we wrap up, I want to give you some specific action steps you can take right now. First, if you haven't had a prostate check in the last year and you're over 50, book an appointment with your GP today. Not tomorrow, not next week, today. Early detection saves lives, full stop. Second, if you're experiencing urinary symptoms, erectile dysfunction, or other concerning changes, don't wait. The longer you leave these issues, the harder they can be to treat, and often they're symptoms of other health problems that need addressing. Third, take an honest look at your lifestyle. Are you carrying extra weight? When was the last time you did proper exercise? What's your diet like? These are areas where small changes can make big differences. You don't need to become a gym junkie or a vegan, just make some sensible improvements. Fourth, if you're worried about your testosterone levels or libido, ask your doctor for a blood test. It's simple, and if there's an issue, there are treatments that can really help. Fifth, consider seeing a pelvic floor physiotherapist. Yes, they exist, and yes, they can help blokes. They can teach you exercises that improve bladder control and sexual function. It might feel a bit weird at first, but the benefits are worth it. Look, I know this has been a long video, and I've covered a lot of ground, but this stuff matters. Your prostate health affects your quality of life in so many ways, from how well you sleep to your confidence to your relationships. And the good news is that there's heaps you can do to protect your prostate and maintain good sexual health as you age. The bottom line is this: masturbation, when done in moderation, can be a healthy practice for men over 50, provided you don't have untreated prostate problems. It has positive effects on mental and physical health and allows you to reconnect with your body and improve prostate health. But it's not a magic bullet. It needs to be part of a broader approach to health that includes good nutrition, regular exercise, maintaining a healthy weight, and regular medical checkups. Remember, every person is unique. What works for one bloke might not work for another. That's why it's so important to discuss these topics with medical specialists and intimate health professionals. These professionals can provide advice tailored to your individual needs. Don't be embarrassed. Don't put it off. Your health and happiness are worth the slightly awkward conversation. I hope this video has helped you understand yourself or someone you care about a bit better. If it has, please share it with your mates who might benefit. I know it's not typical Barbie conversation, but that's exactly why we need to talk about this stuff more. Subscribe to the channel for more videos where we tackle the health issues that really matter to you blokes. In upcoming videos, we're going to dive into more topics that can help you live a healthier, happier, and more satisfying life through meaningful connections. We'll talk about testosterone replacement therapy, foods that specifically benefit prostate health, exercises for better sexual function, and how to have those important conversations with your partner or your doctor. Remember, it's never too late to get the best out of your life. Value your body, maintain positive relationships, and don't be afraid to seek help when you need it. Join me on this journey of personal development and self-discovery, because your quality of life deserves the best care and attention. Drop your questions and comments below. I read every single one, and your input helps me create content that actually addresses what you need to know. If there are topics you want me to cover in future videos, let me know. This channel is for you, and I want to make sure I'm giving you information that genuinely improves your life and well-being. Until next time, take care of yourselves, look after your mates, and remember, there's no shame in taking care of your health, whatever that looks like for you.